Ram Dhanishri welcomes you all to this episode of Shri Ram Krishna Netralaya. As someone once said, our eyes are used to interpret everything around us, and to have a clear vision of your life, you should have healthy eyes. To have clear vision, healthy eyes, clean eyes, we have the best guide with us, that is Shri Ram Krishna Netralaya. This episode is specially for Patient Awareness Initiative by Shri Ram Krishna Netralaya, where they offer efficient and affordable treatment to every eye problem. Today we have with us Dr. Prerana Shah Panoli, who is MBBS, DNB in ophthalmology, and also received fellowship in vitreoretinal surgery from world-renowned Aravind Eye Hospital. She has more than 10 years of experience in retinal disorders. Today we are going to talk about diabetic retinopathy. What is that? Let's ask Dr. Prerana Shah Panoli. Hello doctor, welcome to this episode.
Thank you Dhanishri, thank you for having me here.
As I said, today we are going to have knowledge about diabetic retinopathy. Can you explain it? What is diabetic retinopathy?
Well, diabetes is one of the ongoing endemics in the world, and India is the leading number of diabetic patients. If you have diabetes, it is a multi-system disorder, and also it affects the eye. If you have diabetes, there will be cataract, glaucoma and diabetic retinopathy. And with diabetic retinopathy comes the problem of vision loss, and that is why we are here discussing about diabetic retinopathy.
But why does it happen? Why does diabetic retinopathy happen?
Well, diabetic retinopathy is a disease of small vessels. That means if you have diabetic retinopathy, diabetes will cause sorbitol to flow in your blood. Sorbitol will cause increased oxidative stress in the blood. So your small vessels, which are called capillaries, will tend to ooze out and become larger. They are called as microaneurysms. Those microaneurysms will leak. Once they leak, there will be fluid accumulation in the different layers of your retina. Long-term fluid accumulation will cause lipid deposition or fat deposition in the layers of retina, which is one of the reasons of vision loss. However, if this continues, then even the large blood vessels of your eye will get affected. They become dilated, frizzy and start leaking out blood. Then it causes red spots to happen in your retina. Those are bleeding spots or hemorrhages. Also, if there is long-term diabetes, we can see white spots or cotton wool spots, which are due to swelling of the nerves in the retina. Now these two are the presentations of the earlier stages of diabetic retinopathy called non-proliferative diabetic retinopathy or NPDR. It's divided into mild, moderate and severe depending on what your doctor can see in the retina.
Okay.
However, if this continues, the leakage can happen in the center of your eye called the macula. The macula is responsible for central sharp vision. However, if there is leakage, fluid, accumulation of lipid deposits or fat deposits, then there is a drop in vision. That is called as diabetic macular edema. If it is significant to be diagnosed by a doctor, it is called as clinically significant macular edema. So if there is diabetic macular edema or clinically significant macular edema, the vision will drop. If the vision drops, then it needs treatment. However, in the state where diabetes is not controlled, your sugars are high, the retina is under continuous oxidative stress. In that case, it cannot provide adequate oxygen or nourishment to all its parts. In that case, new vessels or neovascularization will happen on the surface of retina. This stage is difficult. It is called as proliferative diabetic retinopathy and needs immediate attention and treatment. If the new vessels keep on leaking and bleeding, they cause a fibrous or a scar tissue to form on the surface of retina. This fibrous and scar tissue is unhealthy and it causes the retina to get contracted and separated from its base. This is known as tractional retinal detachment, which requires even higher treatment, that is surgery.
But why is it needed in today's world to have knowledge about diabetic retinopathy?
Well, diabetic retinopathy can happen in type 1 diabetic patients, it can happen in type 2 diabetic patients. It is just that an earlier diagnosis or timely treatment can help you and save you from vision loss.
What are the treatments available for various stages of diabetic retinopathy?
If we consider non-proliferative diabetic retinopathy, mild, moderate and severe, without any diabetic macular edema, the treatment remains good sugar control, good sugar control, good sugar control. However, if you have diabetic macular edema, the treatment options are laser photocoagulation or intravitreal injections, where injection is given inside the jelly of your eye called vitreous. But prior to laser photocoagulation, we need to do a test called OCT or ocular coherence tomography, which gives you an idea of how much edema or how much fluid in the retinal layers needs to be treated. Also, if there is leakage from specific microaneurysms, we offer a test called fundus fluorescein angiography, which is angiogram of the eye, wherein a specific dye called fluorescein is injected through your arm and it reaches the retina to show where the leakage is happening. In that case, we can offer something called as focal laser photocoagulation, where the bleeding points are lasered. In intravitreal injections, we just give anti-VEGF injections into the eye, which help in decreasing the diabetic macular edema.
Okay.
So this was the treatment for non-proliferative diabetic retinopathy. What do we do in proliferative diabetic retinopathy? As I said, it is a disease of neovascularization, and the treatment is something called as pan-retinal photocoagulation. At Sri Ramakrishna Nethralaya, we have a top-end laser machine that helps us do the pan-retinal photocoagulation. With this timely done laser photocoagulation, the new vessels will regress and it will prevent bleeding into the eye. If there is bleeding into the jelly of the eye, it is called as vitreous hemorrhage, or if there is tractional retinal detachment, then we require what is known as microvitreoretinal surgery. During microvitreoretinal surgery, we offer a sutureless surgery, which is an advanced technology wherein we remove the diseased jelly of the eye and flatten the retina so that there is chance for the retina to absorb light and send impulses to the brain. This advanced technology is offered at Sri Ramakrishna Nethralaya at very affordable price. Also, the outcomes of timely done surgery are good. However, if surgery is done later, it might need multiple sessions, which also can give you a good outcome.
As this can be a complicated disorder, when should a diabetic patient get evaluated for diabetic retinopathy?
That is actually an excellent question. Well, whenever you are diagnosed with diabetes, you are asked to get an eye checkup. That is a baseline eye checkup. During that checkup, we will check for your vision, intraocular pressure, a complete dilated retinal examination after putting special dilating drops. We will also get a baseline OCT test if necessary, get a fundus photo for documentation. Also, if we suspect that your vision and retinal findings do not match, we might offer you a test called ERG, which is a high-end test which can diagnose all the hypoxic changes even without presentation of disease in the retina.
As we all know, Sri Ramakrishna Nethralaya always come up with the advanced technology. So my question is, how you can save the patient from vision loss?
Well, timely checkup is what is important. If you are a diabetic and you feel your vision is dropping, do come for a checkup. A timely checkup, good sugar control, good control of your kidney problems, adequate lipid levels or blood cholesterol levels, keeping your blood pressure in check, getting an OCT done on time. If you have vision loss, getting the treatment done on time. If you have proliferative diabetic retinopathy, getting a pan-retinal photocoagulation on time. All these tests will help and keep vision loss at minimum.
Thank you, Dr. Prerana, for coming and guiding us on diabetic retinopathy. Thank you so much.
Thank you for having me.
If you are facing any eye problem, specifically diabetic retinopathy or related to your retina, you can always contact Dr. Prerana Shah at Sri Ramakrishna Nethralaya. As we all know, this episode is specifically for Patient Awareness Initiative by Sri Ramakrishna Nethralaya.